Hello, my name is Victor Bishop, and I'm the Marketing Programs Manager for Audience Engagement for JBJS, the Journal of Bone and Joint Surgery. I'm here with Lloyd Resnick, the author of the JBJS and the Journal of Orthopedic and Sports Physical Therapy's special report entitled It Takes a Team. This publication is available now at sites.jbjs.org/it-takes-a-team/2014. The report explains how multidisciplinary healthcare teams prepared for the 2013 Boston Marathon bombings, responded to it, and helped survivors rebuild their lives afterwards. It Takes a Team details how collaborations among physicians, physical therapists, and other clinicians led to improved outcomes, quicker patient recoveries, and fewer complications. And with that being said, I'd like to jump right in and ask you, Lloyd, a few questions. Why did JBJS and JOSPT choose the Boston Marathon bombings as a topic of a special report?
Well, Victor, our first co-published special report focused on how teamwork among orthopedic surgeons and physical therapists and other healthcare providers improved patient outcomes. In that report, we wrote about 8 specific cases of excellent collaboration in clinic and hospital settings. After the tragic events of April 15, 2013, we realized that there would be many more cases of surgeon, physical therapist teamwork to investigate. Soon after our research began, we discovered that the readiness and preparedness aspects of mass casualty disasters, which also involve orthopedic surgeons and physical therapists and many other professions, had to be a part of the special report. So the theme of teamwork broadened further than we had originally conceived. We were also aware that as thorough as the general media coverage of the event was, there must be behind-the-scenes stories related to this unfortunate event that could benefit orthopedists, physical therapists, and other healthcare professionals. And we wanted to uncover and share those learnings so that responses to similar tragedies in the future could be improved.
Okay. Well, what insights can the orthopedic and physical therapy community glean from reading this report?
I think the main insight was a re-emphasis of the main message from our first special report: teamwork works. In a disaster setting like the marathon bombings, people let go of their normal roles, titles, and status, and they participate in a team-based effort. The special report reveals how physical therapists were first responders, and they went outside their normal work to compress wounds, apply tourniquets, and get people onto stretchers and into ambulances.
Sure.
On the other side, usually take-charge orthopedic surgeons at the Level 1 trauma centers in Boston deferred to the incident commanders at their hospitals and happily did what they were directed to do. I think orthopedic surgeons and physical therapists can also glean a lot about communication and relationship building from the special report. Communicating face-to-face is important.
Yep.
But so is getting the various communication systems to talk with one another.
Sure.
That was a huge challenge in disaster response that involves EMTs, multiple providers in the hospitals, and local, state, and federal health officials. Also, I think orthopedists and physical therapists already know and appreciate that each patient is a unique individual. But the special report does reveal that survivors of mass casualty trauma have non-physical needs. And I think it reveals how these two professions, while not specialized in psychological matters, can help patients recover emotionally also.
Okay. For the general audience, can you give a little insight into the reports? Let's say one of, a little bit more of the overtone?
Well, I would call it one of awe and respect. First, for the people who died and their families, and for those who survived but whose lives were changed forever. We've also tried to instill a tone of awe and respect for the multitude of healthcare providers who are helping the survivors get their lives back, and for the professionals who work behind the scenes to ensure preparedness and an effective mass casualty response. Also, the healthcare landscape in Massachusetts is very competitive. But as the report reveals, people in the fields of emergency preparedness and response are all about cooperation, not competition. And I think the report implies that this spirit of collaboration over competitiveness could and should be translated into the non-emergency aspects of healthcare delivery.
Great. In doing this special report, what was it that stuck out the most about the people, their stories, their tragedies, triumphs, and anything that may have occurred during the bombings in 2013?
I think I was most impressed by the resourcefulness and resilience of the people who were injured and of those whose lives are dedicated to preventing such injuries, and to those who treated the injured, both acutely and over the long term. I was also reminded during all of the interviews that I did that everyone involved in this, the survivors especially, has good and bad days. The Boston Strong slogan arose naturally and helped galvanize the community. But no one can be strong all the time. And I learned that there's heroism in vulnerability. Heroism in admitting that something is physically and emotionally painful and that you need help with it.
Wow.
I was also amazed by the almost complete lack of bitterness and negativity in everyone I interviewed for the report. People are really looking forward to this year's marathon as a celebration of unity and strength. They're looking forward, not back. I've heard that there will be 36,000 registered runners at this year's race, many of them running in response to last year's bombings, and some of them people who were injured last year and have made remarkable recoveries. And I've heard also that the number of volunteers is up from 1,400 last year to 1,900 this year, which
Wow.
indicates that the marathon has taken on even greater significance. Among the preparedness community, there was a 100% insistence to deconstruct last year's response, identify the gaps, and do even better this year. I have no doubt that the items identified in the special report as being in need of improvement have been addressed, and that no matter what happens during this year's marathon, everyone will be ready.
Interesting. The special report tackles a number of issues within a number of professional fields, primarily ortho and PT physical therapy. How does this report touch on any other industries, or more or less, does this report touch on any other industries, and will it shed light on issues that may have been generally overlooked by, your mainstream media?
I think that, as with our first special report, we found that it was impossible to talk about orthopedic surgeons and physical therapists in isolation. Because healthcare is becoming a multidisciplinary team-based activity, both of our special reports expanded beyond the professions of orthopedic surgery and physical therapy. The marathon report includes information, for example, about the professions of nursing, physiatry, which is that branch of physical medicine and rehabilitation that often gets overlooked, psychology, and emergency preparedness. The field of emergency and disaster management has been around a long time, but it's grown a lot since 9/11. And the special report goes into depth about the hard work that these people do, which I don't think the mainstream media was able to cover. And speaking of the mainstream media, the special report acknowledges the role of the hospital communication and public relations professionals in the marathon response. Once the law enforcement presence diluted, the media really moved in to get information, and the special report discusses how teams at the healthcare facilities dealt with that. Communications and public relations professionals help manage that situation so patients would be protected, and they also communicated important emergency information to their own staffs and to the public.
It's a lot of great information. Thank you again, Lloyd. I'm sure everyone who listens and reads would be excited to read this report. Thank you. Once again, this publication is available now at sites.jbjs.org/ittakes-a-team/2014. It is impossible to name everyone who contributed to this publication within the scope of our short interview with Lloyd. So I'd like to direct everyone to page 3 of the publication to see a list of acknowledgments.